We basically build a financial incentives overlay on top of any clinical care journey that draws people towards their care, drives adoption higher. You actually see a big jump in adherence as well.
We are at Health. I'm with Matt Swanson, the CEO and founder of Reciprocity Health. You're also here. Your signage says Therapy. Why is that?
Well, it's interesting. We've got a company founded as Reciprocity Health, and then we have a product, Therapy, which is what we are actually selling. So we've gone through a journey of how do you co-brand a company name with a product, and we found that clients really respond to hearing the Therapy name as the lead, so we've sort of just accentuated that more and made it more obvious for the people that are looking for our product how to find it.
Well, it's a pretty slick co-brand because therapy in the healthcare space.
Yeah. You need to go through that founder journey of the whole portfolio of possible names and land on something. And part of that is when you look up the URLs, what's been taken, what already costs you 6 figures to try to get. We got really lucky with the name Therapy that was available and really tells the story of what we do.
That's not an easy process. It's not easy to find that mix. Okay, so Reciprocity Health, you're doing really interesting work in incentivizing healthy behaviors through finances. Sort of break it down for me.
So we've really found that there's a gap in the market. We came to market with the idea of building financial incentive programs that addressed a struggle that payers and health systems have, especially in Medicaid, low-income populations being offered excellent care, but not choosing to adopt and take part in that care journey. So we basically build a financial incentives overlay on top of any clinical care journey that draws people towards their care, drives adoption higher, and then when you breadcrumb the incentives across the entire journey, whether it's 3 weeks or 9 months, you actually see a big jump in adherence as well.
I mean, just to simplify it and make it personal, there's a lot of things that I know I should do and I don't do for whatever reason. And so how much does it take? What do the financial incentives look like? What does it take to get somebody on a new care plan, adopting new behaviors? It's hard.
It is, and there's no one simple answer, which is why we have a full-blown team, behavioral economics team in the company. And so when you're given a new care journey, there are going to be different levels of effort associated with that. There are going to be different populations that you're reaching out to. And sometimes there's stigma attached to a particular condition. So there are all sorts of barriers. But when you start thinking about the universal barriers, mistrust of the medical system, overwhelm or confusion about what you need to do next, really a intimidation sometimes of a massive care journey like diabetes management, something like that. So those are usually the fundamental underpinnings of someone being hesitant to take on that care. And we have a starting point with a set of criteria around the ROI that our client is seeking. That sort of gives us a budget to work with. And then the behavior.
And who's a typical client?
So Medicaid MCOs are our core client right now, but we work with FQHCs and bigger health systems as well.
Federally qualified health centers?
Federally qualified health centers, exactly, which are systems of clinics that are serving that low-income population, typically Medicaid-based as well. And so we'll take that huge mix of how long is the curriculum, how complex and intimidating is that curriculum, what is the budget that we have for incentives, and then we build an ROI model around that to show the client that if we can boost adoption and adherence by 10 or 20%, even though they're paying us to do the work, even though they're now paying rewards on top of that, the payoff for that in avoiding hospitalization, avoiding other costs, is a multiple of that.
Okay, and what do the rewards look like? Is it like $1 here, $1 there? Is it Amazon gift cards? What does it look like?
Now, a really important aspect of what we do is that each member gets a personalized, reloadable debit card. And so that is really important for a couple of reasons. Number one, it allows us to breadcrumb an entire journey where you're getting $10 and $20 loaded onto that card, sometimes immediately when someone completes a task. And that is a persistent touch point where we can stay involved with that person. They can always be reminded in their wallet, wow, I wonder if there's more I can earn.
Okay.
And they can just go check their app and see what new rewards are available. And then there's a balance on that card. So they can check their app and see, oh, I've got $200 on this card. What do I want to do with it? And then we do a lot of programming about where they spend that money that can start to address some of their social determinants of health.
Is that highly directive, or what kinds of places can they spend it? Is it extremely useful to them, or do they have to shop at Walmart or Amazon?
From a behavioral economics standpoint, you want to get as close to the freedom of spending cash as you can.
That makes sense.
That's what really drives the behavior change. But of course, we put guardrails on it. So we can modify that to the client, but typically we'll do firearms, tobacco, casinos, alcohol. The card won't work.
Okay.
Sometimes we have clients who want to get more directed than that and have the card only available for healthy food, for example, that sort of thing. So we can really modify that for every specific program.
Now, it seems to me people have been doing behavior modification incentives for a long time, but the difference here is you said a minute ago that you have a team of behavioral economists.
Yep.
So it's just a smarter application of that idea. Is that right?
So the design is important. So we've built a platform that has flexibility on two different ends. Number one, we are clinically agnostic. It could be a maternal health program, diabetes program, a hospital discharge program. So what you get there is you need a platform that's flexible enough to go out and create that financial incentives overlay on anything. So the platform there and what it can do is second to none. Then the complexity on the other side allows that behavioral economics team to use the full tool chest of reward design. Reward levels matter, but the design and the framing of it matters as well. So we can really cook up the best way to move the needle on engagement, knowing what are the harder steps in a program and how to really motivate people. And then from there, you really need the full orchestra of a digital app, making clear what are the steps in the roadmap, what are the rewards for those steps. You need an omnichannel platform that is doing the messaging, reminding, nudging, and encouragement. And then you also need tools within the app that help people earn rewards immediately, like taking an SDOH survey or setting up a lab screen. And that, with that immediacy of a reward, you build a lot of trust and confidence in the program overall.
Okay, so I think last year when I interviewed you, you'd completed a round, you raised a few $1 million,
Yep.
allowed you to move to the next sort of phase of development.
That's right.
What are the next milestones you're looking for?
We've been really building the team out. So we got Chief Growth Officer who just joined, 2 more technology people added to the behavioral economics team, really allowing the team to scale. So that's been really exciting. A lot of really great talent brought into the company, and that really opens your eyes to the possibilities of different directions we can go. So we're now moving into health systems, Medicare. We're launching a new DSNP program. So it really is allowing us to feel out these different opportunities and areas for growth. And so 2025 for us is going to be a massive growth year.
I love it. What you're doing is so smart. It's complex enough that it creates a moat, which I think is so smart, and you're actually helping folks pay for things. I mean, at the end of the day, this is actually going to help somebody maybe afford a vacation at the end of the year that they weren't able to do.
Yeah, I mean, we've got Medicaid families that are earning $700-800 across the kids, the spouse, and all of that. That's really meaningful income for them. And we have certain families with custodians where the kids have a card assigned to them, not the parent. And we have those parents calling in and saying, you know what? This is their goal for the year, is to earn enough money so that they can buy that one thing they really wanted. So you start to hear these stories about how meaningful it is that people are earning these rewards. And it's just wonderful to see that we're putting money in their pockets, but at the same time, we're getting them a lot healthier.
I love it, Matt. Thanks for taking this little walk with me. Explain to me what you're working on.
Great to see you.